Hello, my name is Donovan Brooks, certified financial planner, certified kingdom advisor, and owner of Prosper Purpose Wealth here in St. Joe. And I wanted to make a video going over the benefit package for Mosaic Life Care here in St. Joseph, Missouri, one of the largest employers here in Northwest Missouri. And I felt like a lot of people could benefit from this. So a couple housekeeping items, a couple notes is I will be going through the 2025 benefit enrollment guide. So if you're watching this at some point in the future, a lot of this may be the same, the benefits, but also be sure to check your current enrollment package, your current benefit guide to compare and contrast what's different, just so you're seeing everything through an accurate lens. The other thing that I wanted to note is that nothing in here should be construed as financial advice. This is just me going through guiding and informing and educating what is available to Mosaic Life Care employees. And hopefully it's valuable. That's what I want this to be, is just a valuable video. Oh, and one last item is that if you're not watching this sped up, I encourage you to condense it and make it shorter. Sometimes I can ramble, sometimes there may not be as relevant of information, but definitely consider watching this sped up via an extension on YouTube, or if there's any other video player you're watching, sometimes they have built-in features to speed this up. So I'm just gonna go in order of the guide. So if there's anything specifically you wanna hear about or listen about, you can find the contents and find where I'm at and skip through to that. So up here at the top, there's some kind of items to preface the guide and the information. The passive enrollment feature is pretty cool. It pretty much is this concept of if you miss enrollment or fail to enroll by the deadline, your prior year benefits are just going to carry over to an extent. So that's nice. If for some reason you miss it, you're not going to be necessarily penalized by not having any benefits whatsoever. They're just going to copy and paste the prior year's benefit elections to the upcoming year, with the exception to these bulleted points. So if you are adding or removing dependents, if you miss that, you're likely going to have to wait till the next enrollment period, or changing plans between dental and vision plans, electing paid time off, buyout, enrolling in flex spending accounts, medical and dependent care flex spending accounts, changing any wage differential options, a couple surcharges like tobacco or spousal. So I'm guessing this is maybe if you've stopped smoking or stopped using tobacco products. This is if your spouse has an eligible healthcare plan at their place of employment, but they opt out of that to be a part of your health insurance plan. There's a surcharge for that. So if you want to waive that, this is a time to do that. You won't be able to do that if you don't get that done during your enrollment window. And then any changes to caregiver campaign pledge options. So these would be the exceptions. If you need to make changes to any of these bulleted points, you want to make sure you get that done during your designated open enrollment period. Here is table of contents. So this is the order of kind of the options that we'll be going through, and then they do have some instructions on how to enroll. So hopefully they've made that pretty clear, but if not, there's some instructions on how to complete your open enrollment and benefit elections. Eligibility, caregivers, so it's going to say full and part-time caregivers with base hours of at least 32 hours per pay period are eligible to enroll in Mosaic's benefits. Unfortunately, if you're under those limits, you won't be able to have kind of the full benefit package. This is, I think, what they coined kind of that part-time limit. Anything under that is designated part-time, anything above that full-time. So if you're under this, I'd be looking at ways to increase hours to make sure you're getting the benefit package. Dependents, it's just going to identify eligible dependents, legal spouse, dependent children, including stepchildren up to age 26 under medical, dental, and voluntary plans. And then this is super important too. They're going to highlight what qualified life events are, what they are, and what these events mean for a special enrollment period. Oftentimes in life, we're in certain seasons where certain things happen that will allow us to change our benefits via a special enrollment period. Mid-year changes are only allowed if you have a qualified change in family status as defined by the IRS. These examples are marriage, divorce, legal separation or annulment, birth or adoption of a child, loss of other health care coverage, and change in your dependent's eligibility status because of marriage, age, etc. So you have 31 days to make those changes. It says if you do not file appropriate paperwork within 31 days, coverage changes will be denied. So a nice little graphic and reminder of what those events are and kind of your timeline, deadline to make those things happen. Some information on dependent verification. So they will be verifying dependents that you have listed. What does it say? If you enroll a new dependent, you must provide for a spouse, current tax return or marriage license, Social Security card, independent birth certificate, and Social Security card. So they're just making sure that these people in your life that you're saying are dependents really are dependent on you. Okay, some information on the MyChart online patient portal and utilizing that. Some information on in and out of network. I won't really go through that, but here are the necessary resources to access those items and research in and out of network providers. Caregiver Quick Clinic. I was unaware of this. I actually have several Mosaic Life Care clients, so this was a cool little nugget of information I learned. So it looks like there is a designated clinic for Mosaic caregivers, their spouses, dependents, etc. that's covered under Mosaic health insurance to access quick and free health care. So it's a family nurse practitioner that sees patients for minor acute conditions. So instead of trying to get into your primary or a emergency care clinic, you have this designated quick clinic that you can access and see the physician, but if there's any prescriptions that you need as well. So that's something that could save quite a bit of time to be able to get into and see a provider. Health insurance, these are the plans, the tier plans. I won't get super in depth with these, but you can see there's 4 different plans available. So we have this matrix of the plans, and over here we have annual deductible, coinsurance, medical out-of-pocket max, any co-pays, inpatient, hospitalization, urgent care, and emergency room. When it comes to health insurance and picking plan, it really depends on your medical history, what you foresee the upcoming year looking like for your family, your dependents, yourself, in terms of procedure, care that's needed. It depends on certain preferences, like if you want to be able to have a preferred provider, have say in picking those individuals, how much out-of-network costs do you envision having, specialties, things like that. So there's a lot of conversation that goes into kind of picking the plan, but certainly if it's not broke, don't fix it for you personally, but also it's something that you probably should review pretty periodic to make sure you're not spending more money than you need to. Again, helpful information to review. Again, just to review some of these items. A deductible is what you have to pay out of pocket before coinsurance kicks in. For all these plans, for most of them except this out of network plan, if you are just on your plan as a single individual, you'll have to pay $1,500 out of pocket before coinsurance kicks in. If you're a family, you have to pay $3,000 out of pocket before coinsurance kicks in. So once you meet your deductible, insurance is going to cover the designated percentage and you will cover the rest. So in this tier 1, the example, insurance would cover 90% of eligible expenses and you'd be responsible for 10%. In this tier, insurance would cover 80% of eligible expenses. You would cover 20%, and so on and so forth. The maximum out of pocket is going to be the total amount of what you would have to pay out of pocket for that specific year for insurance coverage. Again, it's only going to be for that specific identified year of coverage, but it will include the deductible. Your deductible does get applied to that max amount of pocket. So if you're single, you're going to have to pay another $1,500 in expenses that have been allocated to you through coinsurance, and family is $6,000. So that's a little bit of how that works. Not everyone knows the intricacies and how kind of the insurance part works. Even if you work at an organization that's a hospital or in medical care that you deal a lot with insurance, a lot of people still don't know how deductibles, coinsurance, max out of pockets, things like that work. Copays, physician and specialist, this is the cost that you pay per visit. It's this rationing device. So in order to help deter people from going to the doctor's office for every little thing, they institute this kind of initial charge to help combat that, just because our physicians only have so much time and there's only so much working hours to be able to see patients. So copays are required for each of these tiers in these kind of descriptors to see a physician. Inpatient hospitalization, 90% after deductible. So once you meet your deductible, 90% is covered by insurance, or whatever the designated tier is after deductible is met. So again, you're paying the remaining. So 10%, 25%, 30%, and so on. Urgent care, again, these kind of specify the limits or the costs or when they kick in. And then emergency room. So I won't go through all that, but hopefully you get the idea of how to read this matrix. Health insurance premiums per pay period is pretty straightforward, broken into full-time caregiver, part-time caregiver, and then the specific kind of types of insurance plans based on who is on that. So caregiver only, if you make under 50,000, this is how much it's going to be per pay period to have health insurance. And then as your income changes, you can see how the premiums change. So each one of these has a spot on this matrix. So that's how you can see the cost for health insurance premiums for the group plan. Interesting. Okay, and then here is the monthly surcharges that I mentioned above. If you are using tobacco or you have a spouse on a plan, on your plan that has coverage at their place of employment, but they're opting out of that in lieu of your plan, there's a monthly surcharge. Pretty pricey. There has to be a reason why this would be worth it to opt into that. Okay, so I won't go too deep into the drug pricing program, but here's all the information for the pricing for the 340B program. So here's some information up here on what is eligible and what is relevant for this, but here is all the information for the breakdown of the prescription drugs through Mosaic's healthcare plans. Dental insurance, here is the breakdown for dental insurance. I think dental insurance is one of those things that often is overlooked quite a bit. We just opt in. We know we need it, we should use it, but kind of what type of plan? Should we use the base plan or the buyout plan? And what does that look like? Yeah, for most people, definitely want to opt into at least the base plan because it's going to cover diagnostic and preventative services. So if you're doing your kind of twice a year routine check, it definitely makes sense because these services out of pocket can be pretty pricey. But then especially when you start to get into orthodontic services and any procedural stuff, that's when you definitely want to consider the buyout plan. So if you have kids, it could definitely make sense, or any major services on the next year horizon, it could definitely make sense to opt into the buyout plan, or the buyout plan, not the buyout plan, and have those covered into that kind of modified plan. So over here, this kind of shows what is covered and in the percentages. So you can kind of look and deduce maybe what's going to be worth it for you at this time. For example, if you don't have any major services needed on the foreseeable future, you've been doing your routine checkups for preventative service and care, they've done x-rays, they don't see any issues, then this base plan is probably going to be good enough for you. But if you want to have the buyout plan for peace of mind, I understand the peace of mind for as well. So it's only for a single individual on a plan, it's only less than $4 pay period for that buyout plan. Could be worth the peace of mind because emergencies happen and you wouldn't be able to go back and change that and get these benefits if an emergency happens. So could be worth it for the peace of mind. Again, deductibles for these plans, pretty low deductibles. Dental insurance is definitely very different than health insurance as far as the structure of the group plans, but this is all the information there. Yeah, and there's some separate lifetime orthodontic max that is covered as well. So it looks like on these specific services that there is a max per dependent. So you'd be looking at out of pocket for anything above this amount on a dependent level basis. So anyway, and then here is the breakdown of insurance or dental insurance premiums per pay period. Yeah, for your information. Vision insurance, very similar to dental insurance on the condensed service and premium outlook. But here we have two different plans. We have the Core Exam Plus plan included with health insurance enrollment. Oh, it looks like this is included in your health plan. So this is automatically incorporated in the health insurance enrollment. And then you have this signature buyout plan. You know, how these plans typically work is if you have someone that has vision problems or needs corrective lenses, it typically always makes sense for the buyout plan. But you can sit down and do the math. Definitely encourage people to know their real costs when it comes to vision and dental and apply those costs to what they would pay with and without insurance. That's a helpful exercise. Most of the time you'll find that you're going to pay overall, on an overall level, you're going to pay less in expenses with one insurance, but two, the buy plan. Not always the case, but just the way it's designed, just the way out-of-pocket expenses are, and if you're not the one to negotiate, that's typically going to be the case. Anyway, so that's a little bit about the vision. I won't go into too much of the detail, but that is your vision insurance page. So we continue. We're on flex spending accounts. So there's two types of flex spending accounts, a medical and a dependent care flex spending account. How these work is that you can elect to have deductions from your paycheck on a pre-tax basis. So any money that is deducted, whatever you opt to enroll at, like whatever the amount of deduction that you want to happen for the year, that'll get divided out between your pay periods, but that's going to be taken out before taxes. So you won't have to pay tax on that money when using it for qualified expenses. So that's super nice if you know what your upcoming annual expenses are, because the thing about these flex spending accounts is it's typically use it or lose it. If you don't use it, all that money or the remaining money in the account by the end of the plan year, and if there's any grace period added on top of that, if you don't use the money in that time frame, it's typically lost. It's removed and you don't get to have access to it. You don't get to spend it. There is some hesitancy with these accounts that I always talk to my clients about. Try to pin down what you know exactly you're going to spend in the upcoming year and try to stick to that so you're not wasting money, so you're not throwing money away. Now, for a lot of you, you might just know, hey, I've seen the data, I've seen the spending. I know for sure that I'm going to spend more than the annual limit, because there are annual limits for these accounts. If that's your case, then you're pretty confident. Go ahead and max out the accounts. Like, for example, here, like this dependent care account, you can currently do $5,000 per year for like married couples. But childcare, we know, is just obnoxiously expensive, right? So most people are spending more than $5,000 per year for one child on childcare costs. And so most of my clients that are paying for childcare, we're easily maxing it out every open enrollment, because the cost is going to be $10,000 or $15,000 per year, and these contributions are only going to cover a fraction of the true cost of those. Anyway, so that's what my only cautionary advice is. But again, with the way costs are, most of the time we're blowing through the annual max limits and we don't have to worry about it. But it's still something worth considering. Same applies to the medical. If that is a line item for you that you know you're going to spend a lot of money on past the annual limit, then you should feel confident in just maxing it out. If you have a lot of people in your family, dependents, you just know that's going to be a higher line item for you on your personal finance sheet. You should feel confident, in maxing that out. But again, just make sure that you're not wasting any money because it's going unused. Up here, a little information on what covers, what each flex spending account covers. So this is qualified healthcare expenses, including medical, dental, vision, deductibles, copays, and co-insurance. So this really is a broad spectrum of expenses that's covered for the medical FSA. And then over here, daycare or dependent care FSA. So we're looking at daycare, preschool, and elder care. A tighter spectrum of expenses for the dependent care. Be careful, because this can be something that gets audited. But you want to make sure it's really only going to daycare, preschool, and elder care expenses. Oh, one other thing about this is typically there's kind of two ways to reimburse yourself or to cover these expenses. To pay yourself from this account, you may have some sort of like debit card. That is an option, or the other option is you're responsible for reimbursing yourself. There might be some online dashboard where you can access your FSA, and then you are responsible for submitting a claim and maybe even providing documentation for said claim to get the money for that expense. So those are the two options I've seen for getting the money out of the FSA to cover your expenses. Plan year, this shows plan year, January 1 through December 31st. So that's when you're aiming to have those expenses paid for. What is the eligible deadline for incurring eligible expenses? What is the deadline for incurring eligible expenses? So this shows the deadline. This is the plan year. This is the deadline for the actual eligible expenses. So this is the end of the year. For dependent care FSA, you would only be able to reimburse yourself, cover expenses that happened up until December 31st, 2025. This is longer. This may be because there are different plan years for the medical insurance. So this has a different deadline, or this may have a more built-in grace period. It could be a couple of those options. What is the deadline for requesting reimbursement for 2025 FSA funds? So again, the deadline's different than the actual deadline for incurring expense. So these are important dates. If this is stuff that pertains to you, I'd write these dates down on your calendar. So, hey, these are the appropriate deadlines for these specific purposes, so you're not missing out on this benefit. And then when are the funds available? This shows you when funds are available for use. So funds are available upon deposit. So for your dependent care FSA, funds are only going to be available after each pay period for reimbursements. If you are depending on that money to come back to you via cash flow, like right after it's paid, you're going to have to wait until the funds are deposited. With the medical FSA, this looks like you have the full amount that you've elected available to you starting January 1. So if you've elected $3,050, let's just say you've elected that amount to max out, that's the amount that's going to be available to you on January 1, 2025, the beginning of the year. You can then reimburse yourself that, and cover any costs and have that full balance available to you. And then you will just replenish that throughout the year through your paychecks. That's very different than the dependent care FSA, where funds are only going to be available after each pay period whenever it's deposited. So you don't have the full amount available to you at the beginning of the plan year. The funds are only going to be available when deposited from your paycheck. So hopefully that makes sense. A little bit different on when it's available and the timing of kind of reimbursing expenses. So you can learn more by going to the resources that they have here. All right, transitioning a little bit to PTO buyout and wage differentials. So caregivers who are currently accruing PTO may elect to buy out hours in increments of 40 or 80 hours. To receive this buyout, caregivers must have at least 40 hours remaining in their PTO bank after the hours are bought. Caregivers may elect any pay period during the year to receive the buyout during annual enrollment. If a specific pay period is not elected, caregivers may request their elected number of buyout hours to be paid at any time during the year. If elected hours have not been paid by the first pay period in December, they will automatically be paid out at that time. So there is a limitation on this. It says caregivers are required to work for Mosaic for 2 years and 2,080 career hours before their PTO can be paid out at the time of separation, transition to PRN status, or enroll in the wage differential option. So that's good to know. You have to be with Mosaic for 2 years and have this many career hours before these options are available to you. So in regards to PTO, again, you need to have at least 40 hours remaining after you do the buyout, and it's only in 40 or 80 hour increments. So I don't know why they put 80 if 40 is part of an 80 hour increment. Anyway, so that's how that works. It can be paid out during any pay period, or if you've elected to have them paid out but didn't select a pay period, it'll be paid out in early December of that year. Again, could be a nice resource for you if you don't envision on using PTO, or if you've accrued a significant amount of PTO. It's a good way to monetize that and use it for specific financial goals that you may have or things you're trying to accomplish. Super, super helpful that this option exists for you guys. Wage differential option. So this is available to all full-time and part-time caregivers who opt to receive additional pay in lieu of the following benefits. So health and dental insurance, basic life insurance, paid time off, and extended sick leave. So another way to maybe monetize not utilizing these benefits. Maybe you have these available to you, but you just aren't going to use them and don't need them, or whatever the reason is. Maybe you have these benefits available to you on a spouse's plan, or you have them private policies, or some other way of having these resources available to you. You can opt for this wage differential option, and they'll just convert this to additional pay. Is pretty much what that looks like. I did have a client that did do this in a season of life when they were working, I think they were working more part-time, and they weren't applicable to any of these roles. And so they pretty much converted some of these benefits to additional pay. It does say to receive wage differential option, caregivers must be able to provide proof of health insurance, and then specific positions like leaders, physicians, advanced practice providers, certified registered nurse, anesthetist, I can't pronounce that right now, are not eligible for the wage differential option. So there are some limitations here for who can and can't receive it. So again, an option for if you're not using this and you can provide that you have proof of, I think it's most specifically the health insurance coverage. If you're opting for that, you can convert that to additional pay. A pretty helpful option for you guys. Supplemental plans to help offset medical expenses. So this is pretty typical insurance that it's included in what I've seen as workplace benefit packages. So accident insurance, critical illness insurance, permanent life insurance, hospital indemnity insurance. Accident insurance pays specific benefit amounts for expenses resulting from non-work related injuries or accidents. It says hospitalization, physical therapy, intensive care, transportation, and lodging are some of the out-of-pocket expenses this accident insurance could coverage available for you and your spouse and your children. So critical insurance is going to be pretty similar in terms that it's just going to cover or supplement major medical coverage by helping you pay direct and indirect costs associated with critical illness of events. And then it shows the specific conditions under this program that are included, like cancer, heart attack, stroke, major organ transplant, kidney failure, paralysis. So I will stop and say that any of these insurance coverages, you want to check out the underlying plan information, the document insurance, because everything's in the details, right? I know a lot of people have and will get upset because they've elected for a benefit and it doesn't pay out based on what they've come to understand about the plan. There's always stuff in the plan documents and in the details that maybe exclude a certain event or a certain case or a certain illness or what have you. So if you do opt for these, definitely understand what is covered, what's not covered. Permanent life insurance. This is a type of insurance that typically includes a savings component with life insurance. I'm not a big fan of mixing kind of a savings component and life insurance. I think those should be done separately. And when done separately, they're more effective and more cost efficient done that way. So life insurance should be just, in my perspective, for 99% of people, level term, a specific amount of insurance for a specific amount of time. If you want to do any savings, do it on the side via a high yield savings account or a taxable brokerage account, even some sort of separate account. So that's my take on it. That's what I encourage and educate my clients on. Even some of these insurances, even though they're super cheap per pay period and annual cost, a lot of this, if done well, should be absorbed by an emergency fund, right? So typically your 3 to 6 months worth of living expenses, if you have that in a healthy place, or even more for certain people, if you have that in place, you can rest assured that some of these things would be covered. But again, these things are also so cheap that if it gives you peace of mind to just have it elected and potentially get something out of it should you need it, then fine, yeah, go ahead and elect it. And then hospital indemnity insurance, so this is repaying for certain hospital inpatient care expenses, it looks like. Again, read the details. Every group plan is different. Amount of coverage, yeah, so just read that. I'm not going to get into extensive detail. Life and disability insurance, group insurance. I'll start and say this. When it comes to life and disability, group insurance, like this type of workplace plan, can be a great option for quick and painless coverage. It's pretty easy to get, especially if you're under the amount where medical underwriting has to happen. Pretty easy for those that have trouble, maybe or have had trouble getting life insurance. It's another great option to at least get something. Now there are maximums to this and I'll go through that, but these types of insurance, these group life and disability, can serve a great purpose and should be definitely evaluated as a helpful tool for those that need it. Life insurance here, caregiver is automatically going to get 1 times annual salary. So whatever your annual salary is, up to 50,000, I should say. I missed that last part. So 1 times annual salary up to 50,000. If you're a caregiver that is eligible for this, you will get your annual salary, you'll get the lesser of annual salary or $50,000 automatically provided to you. So keep that in mind. Spouse, it says this doesn't really do a good job of describing. So I'm assuming that spouse, if you have a spouse, they're automatically going to have a $5,000 policy as a benefit that's automatically going to be given, and then dependents up to 2,000. That's what this looks like. They're missing some language that makes it vague on amounts and if it's automatically provided as a benefit or if that's kind of opt-in. It says who pays and who is eligible. So Mosaic pays for this. Okay, so Mosaic pays for this benefit. So this is provided as a benefit. Full-time caregivers with base hours of at least 60 hours per pay period. 60 hours for 2 weeks of time is what you would need to qualify for this. So that clears it up a little more than just the numbers right there. Okay, and then progressing down, there's an option for supplemental life and accidental death and dismemberment for the caregiver. So full-time caregivers can purchase supplemental life insurance and accidental death and dismemberment in 10,000 increments up to 750,000 with evidence of insurability. So part-time caregivers are eligible for a prorated portion. So this looks like, again, every group plan is a little different. So it does look like additional insurance would require evidence of insurability. That's what I'm getting. That's what I'm deducing on this. Oftentimes, there's maybe certain limits. You can elect up to a certain limit without evidence of insurability, and anything over that requires evidence of insurability. I feel like the language is very clear on that in those specific companies and use cases. I'm not getting that vibe here. This makes it seem like any supplemental life insurance is going to require evidence of insurability. So that's what I'm getting for this. Caregiver obviously is going to pay for any supplemental insurance. And then it says part-time caregivers are eligible for a prorated portion. So one of the great things about group life insurance specifically is being able to elect an amount without the evidence of insurability. So maybe you've had an illness in the past, maybe you have an existing condition or what have you that makes it extremely hard to get maybe an outside individual private life insurance policy. That's where kind of group insurance has really served its purpose in the past in being able to get coverage without insurability. Again, if you want more information, let me know. If you want more information, I could probably figure this out, or you might just ask HR about this. But I've really enjoyed group policies in the past for that amount of insurance people have been able to elect without proof of insurability or evidence of insurability. Okay, down to supplemental life, and for spouses and dependents, there's going to be different parameters for this. Full-time caregivers can enroll their spouse in supplemental voluntary life insurance, and again, 10,000 increments up to $150,000 with evidence of insurability. You can enroll dependents, again, at $10,000 increments. Caregivers can enroll their eligible dependents in supplemental life insurance up to $10,000. per dependent. So caregiver must be enrolled in supplemental life, and the spouses and or dependents benefit can't be more than 50% of the caregiver benefit. So they're going to limit some of the election for this life insurance based on what the caregiver has. So they're trying to control the amounts and who has what. Caregiver is going to pay for this benefit eligible the first month following 30 days of employment or eligibility status. So that's helpful to know. You'll be able to hop into this pretty quickly to get life insurance if needed for this. Short-term disability. Mosaic offers eligible caregivers the option to purchase short-term disability. Caregiver is going to pay for this, provide 60% of full-time caregivers' income to a maximum of $2,500 weekly, guaranteed issue. However, pre-existing conditions apply. Again, disability policies are extremely expensive to purchase outside of kind of workplace plans. So if you were to go to just an insurance agent and try to drum up a disability insurance policy, you're going to find that they're pretty expensive. They're definitely higher quality. You can design them to be high quality policies, but that comes at a cost, and that cost is higher premiums. So for like my clients that need some protection, we can't necessarily get the Mercedes of disability policies. Workplace group disability insurance policies are a great option to fill in the gap of those potential disabilities. So when we talk about disability, we're talking about something that's going to disrupt you from working or performing your occupation. Again, the important information is in the plan documents and how they defined a disability. Sometimes it's defined in what my experience is the best way possible, and that is Mr. Jones can't perform his very specific occupation of general physician or whatever it is. If you can't do that, then you are coined disabled. Sometimes it's defined as Mr. Jones can't perform any occupation, and that could be working at McDonald's or whatever. In that case, that is a looser definition of disability, and less claims are going to be able to be accepted and paid out under that looser definition. So it does matter how they define disability, and that's all in the plan documents, but 60% up to $2,500 weekly. So if you don't have short-term disability, definitely recommend looking into it and learning about this and how this can play a part in protecting you on the short-term basis. And typically this is only up to 90 days. Again, short-term, it's coined short-term for a reason. It's going to quit paying out typically after 90 days is what I've seen most group plans designed for. That's where kind of long-term disability comes in. So this is for disabilities after 90 days, right? So this is something that has the potential to protect you more on a long-term basis. I'm hoping none of you have a disability that lasts more than 90 days, but it definitely happens. And the statistics show that you're more likely to suffer through a disability than die prematurely. Most of us don't bat an eye about life insurance. We weigh the risk. We see the potential of leaving dependents without resources if we were to die prematurely, and we go and take out a policy for life insurance to be able to provide for them. This and these types of policies, the disability policies, are more likely to be used or to be needed and required because there's a higher chance of suffering a disability than dying prematurely. So all I have to say is definitely tools and benefits to examine and consider using because they do serve a purpose. So this down here says full-time caregivers are provided 60% of their income to a maximum of $7,000 per month after 90 days of illness and disability. So again, may require evidence of insurability and pre-existing conditions will apply. So part-time caregivers, again, that same 60%, but to a maximum of $3,000 per month after 90 days of illness, disability, and the same conditions will apply to this. Caregiver pays this benefit. These in tandem, I typically recommend a short and long-term disability in tandem with my clients that I work with. So between those and then having a fully funded emergency fund will definitely give some front-end protection. The longer disability is where the risk lies and the potential to derail someone's kind of personal finance trajectory. So making sure that is something that is planned for and taken into consideration. Retirement So obviously Mosaic offers a 401k plan. It's administered by Empower Retirement Services. So down here it says Mosaic matches 50% of caregiver contributions up to a maximum of 8% of your contributions. So if you elect to have 8% of your pay contributed to the 401k plan, Mosaic will match half of that. So they'll contribute 4% on your behalf. So you would have a total of 12% going in to your 401k just by electing the 8%. So that is I typically will encourage my clients to contribute at least to what is going to be matched, because that's free money that you're giving. And that's even a good base amount to be funneling into your 401k. Even if you just go by that standard, you're doing 8%, a Mosaic's matching with 4%, you have 12% going in to your 401k. So that's a good baseline amount to be saving for retirement. So that's definitely encouraged. And then especially if you're a new graduate and this is your first full-time job, that's a great place to start and not unwind, not backtrack from that 12%. I understand life happens, certain things have to happen to get you ahead as well, but that is a good standard to start at. Caregivers may change elections at any time, so even if you start at the 8%, you can always increase it during the year, or if you need to decrease it for any reason, you can do that. And then a 3-year vesting period is required for Mosaic contributions. So whatever Mosaic contributes on your behalf, you have to be employed for 3 years to get that money. And I think it's just a 3-year cliff. I don't think it's vested. I don't think a third is vested after a year, and then the next third after the next year, and then the final third after the third year. I think it's all the contributions after 3 years. So that is definitely a form of the golden handcuffs, them trying to keep you there for at least 3 years for those contributions to vest, for you to actually get some value out of that. So that is definitely important to acknowledge. There is something automatically enrolled whenever you start, eligible for match after completion of 1,000 hours in plan year prior to the entry date. So that's okay. So that's something that is helpful to know, that you're only eligible for matching after completion of 1,000 hours. Don't like that at all. Once eligible, caregivers who work 1,000 hours in the calendar year must be actively employed on December 31st to receive that match. Again, do not like this either. I know they've made these changes just recently. I think this is the slimiest of golden handcuffs, the slimiest of ways to retain employees. And I know hospitals are struggling to retain employees, and so they're trying to do what they think is best, but I do not like this. I haven't seen it a lot in my time as a financial planner, having to be employed by a certain date to receive the match. And that match is going to come in one bulk lump sum. Normally, you see matching occur on a paycheck basis. So you contribute your X%, your 8% for this pay period. They're going to do their match for that pay period, and you're matched throughout the year. And what that does is it also allows you to be invested in the market for longer, and also take advantage of down times in the market. When the market is down, it allows you to buy in at cheaper prices, which I think is extremely helpful for those in accumulation phases, younger individuals that are just accumulating their wealth. So I do not like these two pieces of this 401k plan. I do not like it at all. Yeah, anyway, I'm just giving you a piece of my mind that there's other plans out there that are designed in ways that benefit employees in a better manner. But again, we don't join employers just for their 401k plan. Like, it is just a part of the comp package. I'm just here educating what the details are of the comp package as well. So take that for what it's worth. So transitioning to some well-being benefits, we have the Mosaic Counseling Care. So this employee assistant program can assist with these items over here on the right. It says Mosaic offers caregivers and their dependents 5 free visits. And so this could be a good segue into getting some help in these areas. So that is made available to you. There's the Touchstone program, which is a caregiver trust fund for financial assistance during a crisis. And it says it also awards scholarships. That's pretty cool. It's like this benevolence fund. I'm guessing Let's see, caregivers can contribute to, and it's something you can apply for to receive some assistance. So it's crisis assistance, scholarship, caregivers who do not qualify for tuition reimbursement, caregivers, immediate family members. So that's what it covers. LifeLock, identity theft protection offered at a discount rate for Mosaic caregivers and dependents. Don't know a lot about the specific in each one of these plans. What I would recommend, maybe before opting for this, again, this is a peace of mind benefit. If you would get a good amount of peace of mind from this, great, opt for it. But on the front end, I think a lot of work can be done on the prevention side, making sure you are participating in the best practices to protect your identity. What this could mean is not transmitting very non-public personal information, not emailing or texting social security numbers or account numbers or address information or information that you wouldn't want a stranger to have. I would just kind of start with there. If there's information that you don't want a stranger to have, be very careful on how you send that, how you provide that, where you keep that. And that could just be a great place to start to prevent identity theft. Don't click on links that you're not familiar with. Don't download things that you're not familiar with. These are all ways that cyber threats are starting to make their way into the lives of many individuals. And what do they go after? They're going after information. They're going after ways to monetize and profiteer off of your identity. So anyway, practice on the front end, great ways to protect your identity and your information, but also don't be afraid to purchase this if it means peace of mind for you. Fitness centers. Mosaic's proud to offer caregivers a number of options for area fitness centers. It looks like there are some on-site fitness centers that are accessible if you have your badge. That's nice. I don't know what the fitness center looks like, but it may be a way to cancel that gym membership or not have to pay an extra monthly fee for gym membership if you're able to do the same things at this fitness center. Okay, wrapping it up. I know it's almost an hour. That's why I mentioned watching this sped up, but here's a glossary. Again, a lot of this is regarding the health insurance. Health insurance is a very complicated industry, but here's some more information on specific terms and what they mean. Yeah, just for education purposes. Here's what they call benefit roster. So here are the providers for each benefit and the contact number in the website or email to get in contact with that benefit provider. So that could be super helpful to reference and have available at your fingertips should you need to reach out to any of those providers. And that looks to be it. So anyway, I hope this was super helpful. I know it was long, but it's an extensive benefit package to go through. Again, your salary, your wages is just a part of your total comp package. The benefits are the other part of that comp package. So we want to make sure that we're taking advantage of all the benefits you have available to you, just so you can make the most out of your profession and where you're spending your time earning a living. So let me know if you have any questions or any thoughts. If you want to hear anything more about a specific benefit or have any questions about Mosaic's benefits, I can probably dig up some more information. If I spoke incorrectly about a benefit or something on here, let me know as well in the comments. I definitely want to make sure that I'm spreading accurate information, especially regarding something important like this. So yeah, I just apologize in advance if I missed something or if I spoke incorrectly about something, but let me know and I'll try to get it corrected as soon as possible. So anyway, again, I hope this was helpful and let me know if I can do anything for you or if you have any other questions. Thanks. Have a good one. Bye.